Atrial fibrillation, which is an irregular heartbeat, which is commonest rhythm disorder in the world today, usually happen from the left upper chamber of the heart, that is left auricle, around the pulmonary veins, and the left auricle started beating around 500 to 600 beats per minute. So when it happens at the initial stage, it is called paroxysmal, that is comes and goes. It lasts for a few minutes to a few hours and subsides on its own. Then it's a progressive disease. After some point in that time, it goes into persistent. It lasts for a longer period of time. It brings the patient to the emergency and they have to take some intravenous medications or electrical cardioversions to bring back the normal rhythm. In atrial fibrillation, the auricle started working around 500-600 beats per minute. It is fibrillating. So practically it is not pumping the blood. So the patient's cardiac output comes down. They feel low and they feel palpitation and a lot of symptoms like giddiness and breathlessness and low energy, weakness, or these are heart failure related symptoms. Apart from that, the heart beats unnecessarily because of fast, heart muscles get weakened. So this leads to heart failure, tachycardiomyopathy. It precipitates heart failure. Or the patient's already heart is weak because some reason, old heart attack or something. When this further efficiency goes down, they'll lead to they get into heart failure problem. That is the main problem with atrial fibrillation. Other most important problem with atrial fibrillation, risk related to atrial fibrillation, is stroke. Because auricle is not contracting and pumping the blood stagnates. It forms clots. The clots can go to the brain anytime. It can lead to stroke. That is a deadly side risk of atrial fibrillations. The patient's 5 times higher risk of getting stroke compared to the normal person. Cryoablation is a catheter-based procedure done from the groin region under local anesthesia with some IV sedation or some short general anesthesia. We take the balloon inside the heart in the left auricle and using the cooling energy, we disable the electrical activities around the pulmonary vein ostial region by creating a tiny scar around it. So by doing that, we can avoid genesis of abnormal electrical activity, which is called atrial fibrillation, from the left auricle. So this has a success rate of 80 to 85%. This is a short procedure, takes only 60 to 90 minutes time. And many times we do as a daycare procedure. Patient gets admitted in the morning, getting discharged in the evening or next day morning. So because of the shorter duration of procedure and IV, just simple sedation, even it can be considered in an elderly population, which are those who are disabled with this atrial fibrillation. They should be quick enough to opt for catheter-based procedure that is called cryoablation, which can be done under daycare procedure, shorter and quicker procedure, and also carries success rate of 80 to 85%. By doing that, we can avoid taking medications, that is antiarrhythmic medications. We can reduce the risk of developing heart failure. We can reduce the risk of stroke, and also we can avoid progression of the disease in a longer term follow-up concern.